Government and business leaders can no longer rely simply on GDP alone to measure the success and progress of a nation. Developing a greater understanding of people's aspirations, behaviour and fulfilment can inform policy making and economic strategy to enhance and sustain health, happiness and productivity.
What we did as a bunch of our scientists, we just went around and started asking leaders questions, and we said, what do you need to know from 7 billion people so you can do your job better? We found a list of about 100 questions. And if we ask that 100 questions to any man or woman from Beverly Hills to Addis Ababa, we pretty much know their state of mind. And if you said, well, you didn't ask them this, well, we don't need to ask them that because in combination with that 100, we know how they would have answered it. And then we went and we built consistent sampling frames throughout 150 countries. And then every year we asked the whole world those 100 questions. And then at the very end, we have a hunch on what world well-being is. Some people call it happiness, some people call it well-being, and some people call it behavioral economics. Neoclassic economics is the science and an institution of data that records everything that you did during a lifetime. So you're born, somebody writes that down. All of the things that you buy over a lifetime, all the transactions of life, whether or not you go to the hospital, whether or not you go to the service, everything that you've eaten, your grades, everything is written down, then you die, and some guy writes that down, and then that all goes into a great big archive of what's known as neoclassic economics. That tends to be the institution of thought that all leaders in the world make strategies with, the transactions of life. What's not next to that is an institution of what man and woman are thinking. And so what Gallup and Healthways and a bunch of helpful scientists are trying to do is we're trying to create an institution of thinking. And so leaders can build strategies from emotions and the thought that existed before the transaction was made, because there's probably more low-hanging fruit there than in the institution of classic economics. You need them both. But probably in the new world, with as the way things are changing, we need a new institution of data. That's what we're doing. What we're doing in England is we've just ramped that up. So we're asking Brits all of those questions every single night and then rolling them up monthly. Because what we have found is the most important part of it is the trends, not the location. So the direction and the speed of the conditions are more important than the location. So that's why we put in a tracking system. What is the world thinking? Just to grossly oversimplify, what's on their mind is that they want a good job. You say, well, is that new? Yeah, that's a huge sociological change. Because Dr. Gallup, our founder, used to track this years ago, and what it used to be was you wanted to have peace, you wanted to have family, you wanted to have freedom, a bunch of things like that. If you said, what's the biggest sociological change you've seen throughout Gallup data? I would say that all of those values over the last maybe 100 years have now changed to having a good job. So I think Prime Minister Cameron, I think it's very smart that he's wondering about well-being, because well-being, when the most important value you have in your life is a job, you have to consider that well-being resides within that. The new currency of all world leaders is really job creation. And the reason that you need well-being data, behavioral economic data, is somehow you've got to spike job creation. Job creation occurs is where customers occur. That's where we keep finding it. So when somebody's doing a good job at workplace and their customers, more jobs occur there. Every civilization has got to have those jobs, or you get the bad transactions of life over in classic economics. The other place where it is where you have highly inspired workplaces, people quit and start companies. But the second thing is healthcare. And those two fit together kind of funny, but that's where we found the lowest hanging fruit for leaders.
There's this question, what is well-being? Pretty tough one to answer, really. Our definition, based on the experts we've had a chance to talk to, is that it's really all the things that are important to how we think about and experience our lives. I'm going to try to summarize for you what we know around the world, and then I'm going to talk about the UK and what we know here in the UK based on our recent studies. We all know about these GDP, health statistics, employment statistics, literacy, and poverty. Then on the subjective side, there's really two general categories of well-being measures. There's the evaluating measures and there's the experiencing measures. We're really two people. We're an evaluating person who summarizes periodically our lives, and we're an experiencing person who experiences each moment during the day. Those two don't equal each other from a measurement perspective. And so we really have to know something about both, and we have to have measures that tap into both how we evaluate our lives and how we experience our lives. In our polls, we find evaluations, so how people rate their life on a 0 to 10 scale, stays pretty constant over time. It doesn't fluctuate by day. Experienced well-being, though, goes like this on a daily basis. In the US, it goes like this. Weekends and holidays are the ups, and the downs start on Mondays. We have to have measures that tap into both if we're going to do the best job of measuring well-being. Now, what have we learned around the world? Well, basic needs, of course, are important to people. They remove negative affect, and they lead to higher life evaluation. Good jobs are important, both predicting life evaluation and experienced well-being. Physical health leads to life evaluation and better daily experiences. Having a good place to live is important. Both predicts life evaluation and experiences. Income more highly related to evaluations of life than daily experiences, although there's some crossover. And social and psychological needs such as learning, autonomy, and our social relationships relate to our experienced well-being. These are the dimensions that we've had a chance to study in the US and the UK, both life evaluation, which is how people rank their life overall, their emotional health, their physical health, including chronic conditions, obesity, physical pain, colds and flus, healthy behavior, which includes smoking, healthy eating and exercise, and work environment, which includes using our strengths and our manager, how we relate to our manager at work. Basic access includes health care, community satisfaction, and having enough money for basic needs. So those are the dimensions we're measuring. Here's some of our key findings. Less than half are thriving, about 49% are thriving. Work environment is a weakness in the UK. 46% say their community is getting better as a place to live, and Britons of different incomes have similar access to medical care, clean, safe water, but different perceptions of their communities and safety. 1 in 4 are classified as obese. Life evaluation is, we categorize people as thriving if they score a 7 or 8 in the present, 8 or higher in the future. So 7 or higher present, 8 or higher future is thriving on the ladder of life. Suffering, 4 and below present and 4 and below in the future. 49% of Brits are thriving compared to 54% in the US, 40% in the EU overall, and 24% in the world. 48% are struggling, and 4% are suffering. Just to show you some of the connections here, people with more positive work environments, a good work environment, 63% thriving. Those with subpar work environments, 52%. So that's one of the determinants of thriving. In terms of community perceptions, people who perceive their community is getting better, 56% are thriving compared to 48% who are thriving or who say their community is staying the same, and 38% who say their community is getting worse. People who have higher incomes are more likely to be thriving than struggling. In terms of emotional health, it does level off after medium levels of income. You can see the difference between life evaluation and emotional health and how those lead to different potential consequences from an outcome perspective. Emotional health does drop a bit on the negative side as income goes up, but not significantly. People who have kids in their house are more likely to be thriving in the UK. We see the same thing in the US. But in terms of daily experiences, people with kids in their house do have more learning and interest and happiness. They also have more anger and stress. So this shows you that measuring life evaluation and emotional health are two different things, and we have to measure well-being from a multidimensional perspective to really understand what's going on. Physical health is about disease burden. You can see disease burden, high blood pressure goes up with age. 1 in 4 Brits are classified as obese, 43% normal weight. This is based on self-reported height and weight. Healthy behavior is different by gender. Women eat better, more healthy. Percentage of smoke is lower for women. Smoking drops with income. Consumption of fruits and vegetables goes up with income. Exercise is pretty constant across income levels. What's a potential motivator for exercise beyond just the fact that we're going to live longer? Well, just having better days is one outcome. People who exercise have more learning and interest, they have more happiness, they have more energy, they have more enjoyment. they have less stress and less worry on average. In terms of the work environment, we ask respondents, does your supervisor treat you more like he or she is your boss or your partner? Here in the UK, 42% say partner, 47% boss. Stress is higher for those who perceive their supervisor as a boss. Anger is higher. Worry is higher. On the positive end, people who perceive their supervisor as a partner are say they're treated with respect, they have more enjoyment, and they're more likely to say they've learned something. Those who perceive their supervisor as a partner also have better health, better sick days. These effects hold even after controlling for demographic differences. What's behind this? When we've done more in-depth studies on this particular item, it's really about a supervisor who listens to the opinions of an employee, involves them, encourages their development. They perceive they're cared about when they come to work. Those also lead to business outcomes, by the way. What about basic access? Well, we found there's really two UKs when we think about basic access. There's the one UK that across income levels has high levels of medical care and clean and safe water. So regardless of income level, people perceive that they have adequate access to medicine, clean and safe water. That's a nice finding. But it does matter when we look at perception of whether you have enough money for food. That does drop as income goes up. And whether you're satisfied with your city as a place to live. Do you feel safe walking alone at night? You can see that grows with income levels. So there's a bit of an income divide here. People who say they live in an unsafe area do have more daily worry. If they live in an unsafe place to exercise, they also have more worry. Double the rate of daily worry if they live in a place where they don't feel they can exercise. And obesity rates are higher than the average of 25%. So there's a lot to dig into here, and as we collect more data, we'll be able to break it out by locations and regions in the UK, and I know we'll be able to learn quite a bit more.
Easiest way for me to summarize for you what we're doing as leaders around this is to compare and contrast and understand the relationship between this causal data that we call well-being and the transactional data that Jim mentioned is tracked for our lifetime. So on the vertical axis, you have overall well-being and the different components that Jim just went through. And across the top, you see the types of cost or transactions that happen as it relates to people's health, medical cost, overall translation of performance, and this construct of withdrawal, particularly as we look at the work environment. And those check marks in each of the column of well-being is that we've advanced with science to understand that there's deep correlation between well-being and each of those factors. Things like people with high well-being versus low well-being. Low well-being translates to about 3.5 times total cost impact in terms of medical claims and costs. So making sense of the new information that's coming from the Wellbeing Index and tying that to traditional measures begin to help us understand relationships that can be used to pursue what we think is a new and different kind of strategy, which is rather than trying to address components of people's health, whether that be physical, social, or emotional health, looking holistically at the individual, you look at a lot of the different factors that Jim just took us through in terms of understanding well-being, and the challenge is there's lots of different factors that influence that. Oftentimes I get asked, well, what's the value of pursuing that strategy? And I'd rather start at answering a different question. What's the cost of doing nothing or doing nothing differently? To do that, you have to understand what's going on inside of a human as it relates to both behaviors and conditions. In this example that's up here, physical activity versus coronary artery disease, there's some simple ideas, although it's a very, very complex scenario. There's a lot more involved than just simply physical activity and the expression and or risk or the worsening of coronary artery disease. And if you could, and we have, understand scientifically the first order impacts between conditions and behaviors, you could put together a scientific model, in this case using simulation methodology, to understand the demographics, to understand the psychometric health, the well-being data and information, recognize what the proclivity to change is within a population, and then allow epidemiologic science to age those factors over time and how they interact with each other, and see what the likely expression of that into chronic disease and illness is, and then to ask the actuarial and other performance metric specialists to quantify the economic impact. And then to have that model and be able to come back and say, what's the value of pursuing smoking cessation? What's the value of pursuing weight management or the management of obesity? And what kind of impact to certain solutions provide, and how would you define them? The first thing that happens from this simulation is to kind of place where the UK is currently, and you're kind of middle of the road. So on one axis are your health risks, and on the other axis is the overt expression of disease or conditions within your population. We forecast forward for the next 5 years, and this is basically taking well-being data and publicly available information specific to the UK, feeding this engine and letting it run with no due course of change in interventions to make a difference. You should expect somewhere between a 14–15% increase in medical cost as a function of that interaction between disease and conditions. And when you look at the impact in terms of the competitive nature of the UK as it relates to the work environment and productivity, we know that there's likely 9% more lost productivity over the next 5 years. Both of these forecasts are true simulations, and we can understand from that what the drivers are. Cancer, dyslipidemia, hypertension, depression, arthritis make up almost 3/4 of what's driving those medical costs over the next 5 years. But this slide in particular, I think, ought to be compelling to think about how you take information like the Wellbeing Index and begin to make change. Obesity is driving over 1/3 of the productivity loss, and as you guys know, it's a huge ingredient in that manufacturing plant that we think of as chronic illness moving forward. So once you understand that there's a significant cost for doing nothing, one of the things we wanted to quantify was if you just took 8 modifiable behaviors that are in our decision-making wheelhouse every day as individuals and as organizations and as a country, across the bottom you can see each of those factors. And if we just simply said and put back into the simulation model that over the next 5 years that we took out 25% of the per capita risk in any combination, what would the likely value of that be? And we would know that you would project, instead of those increases in costs, actual decreases in medical costs, that we would recover a significant portion of potential lost productivity and have an overall total cost reduction of greater than 10% in the next 5 years for the UK. This projection would have about a £218 billion impact for the UK. And we haven't even talked about doing anything different in terms of how we treat disease. This is just the impact of a reasonable reduction in the modifiable risk factors in this country. I am highly optimistic that the power of the type of data that comes through the measurement of well-being can and should be applied. I think you come up with different strategies and tactics than you would by simply looking at that transactional effect data. There are very high costs of doing nothing differently. It's not going to get better on its own. The primary sources of the costs can be known and identified, and it's not like 100 things that have to be focused on. It's a handful, so it allows for really great models for support and intervention, and you can make a difference in terms of those modifiable factors which will result in lower cost.
We're looking, of course, at economic performance and at social progress, and also the impact on the environment and on long-term sustainability. That's a huge agenda. And the programme of work that I'm leading is to tackle all of that. We're taking our inspiration very much from the Stiglitz-Sen-Fitoussi report that President Sarkozy commissioned. And you know, what we're taking from that is that there's kind of clearly more to life than GDP, and actually more to life than GDP and happiness. We tend not to use the happiness word in that, and it's not that we are averse to happiness, far from it, but we're trying to get at this kind of broader view of what this is all about. Now, one thing I would just slightly question on the Gallup approach, great though it is, there was kind of great emphasis on talking to experts, and I think that's really important. We're doing the same. We have an advisory panel for our work, an advisory forum, but I think what we're also trying to do, going out through a national debate that we've been running since November, is to try and work out what all of us feel is important, what matters to us all, as the kind of basis for wider measures of well-being. If the same kind of things come out as the experts tell us are important, have we wasted our time going through a national debate? We think very much not. This is about kind of engaging with people, getting understanding of why we need to go more broadly. So I think what we're doing is kind of building up a kind of very rich and complex set of information which will give kind of further insights on the makeup of subjective well-being and people's own responses to that. First of all, we've actually got to ask ourselves, how do we get the best out of these subjective well-being measures? You know, the headline results are actually a bit difficult to unpick. They don't these measures don't tend to vary very much in aggregate over time. Gallup put out a finding towards the end of last year saying that kind of Britain's fared fairly well during the economic crisis. There was no kind of perceptible difference really. But that was kind of headline measure. I think if you drill down in that and look at kind of different groups in society, you'd find much more than that. The second point I think I'd like to think about, again it was touched on in the presentation, so let's try and pull it out a bit more. It's kind of what's happening to quality of life over time. We keep going back to people with these kind of questions, and they're bounded questions, you know. Even if we present it as the Cantrell ladder, looking upwards up the ladder of life, but even so, we're only giving people choice between 0 and 10, whereas many of the things that are important to us and the economy itself is effectively unbounded. So we're kind of trying to measure things, measure people's assessment of things on a kind of bounded scale, and recognizing that actually the quality of the things is changing. So maybe an 8 this year is kind of slightly different from an 8 last year, but it's still an 8. How do we unpack that? What does that mean? And the third point to throw in just to discussion, I mean, what actually to do about including children in this? I mean, there's a kind of good point made about children affect our own well-being in a number of ways, but actually the well-being of children is important in all of this. We've not been able to address that in our survey work so far. We only go into households and ask people aged 16 and over, but we could adapt that survey. Is that important? We think it is, but again, we welcome your views.
It's kind of 3 points. Why is it valuable to individuals? Why is it valuable, might be interest to government? And the sort of so what question. So, you know, why is it of interest to individuals? I mean, one of the fascinating things about this whole literature and area, indeed about ourselves, right, is that actually it turns out we're quite good at being able to answer questions about, you know, how do we feel and so on. We're not very good often at predicting what will determine our own well-being. The interesting thing about this stuff is it's sort of you might think of it as the everyday equivalent of, you know, if it's the well-being equivalent of Who Wants to Be a Millionaire, it's a cooler friend or ask the audience when you get this data. And it is a remarkable phenomenon to be able to find out what actually, if I made that choice, you know, if I lived in that place or whatever, well, what would happen for somebody like me, you know. And even though often when you see the data, you think, oh, well, that sort of makes sense, yeah. But actually, it's often not a priori obvious as to what the answer would be. So even if you take something simple about, well, we know income effects, and income generally increases your well-being on various measures. But then if you get in any more detail, well, what about the specific choices would I make? What do I spend it on that makes a difference? Even that, you know, actually we have only modest insight into it. So an example that you cited today is, you can go back to Kath Dunn's work, is, you know, would I be happier if I give some money away, actually, often? And in various works on this, in population surveys or in experimental studies, you find that people think, well, actually, I'd be happy if I have this extra $20, I'll spend it on myself, thanks very much, that's what makes me happier. When you experimentally run it, it's a very, very clear result. When people give the money away, even if they're sort of required to, you give them this gift, you give it away, and you ask them at the end of the day, who's happier? The ones who give it away are the ones who end up happier. So what's interesting about this is that, again, is that plausible? Of course it makes sense, but it wasn't necessarily intuitively obvious to start off with. So this is very relevant. It's very relevant in many domains, actually. One of the things that's really interesting about both the ONS work and the Gallup work is it provides this incredible body of knowledge that we can use in our everyday life, actually. It's incredibly interesting and informative. Why is it of use to government, and should government just stay out of it? One of the arguments often made. Well, one of the things when you look behind these stats at what's driving them, sure, a lot of the things that determine our well-being are choices which we can make about how we spend our money or our lives and how we treat other people. But a lot of it is actually not under our individual control, actually. A lot of it is about what other people do and what's going on in the society around us. So it turns out, even though, of course, subjective well-being is a very personal, individual experience, a lot of the determinants are not within our control. So are there policy implications? One of the things that needs to go alongside it is some of its kind of in the boring but important box. So it's how you do policy, that you take it into account. So there's work going on about reworking what's called the Green Book, that you use it in policy evaluations. You don't ask just what was the outcome in some numerical sense in terms of money, but you say, well, what was the impact? So if you're going to evaluate National Citizen Service, you say, well, what was the impact on people's subjective well-being of serving others or doing volunteering? And not only was there personal impact, what was the impact, the externalities on others who they were associated with? And does it persist over time and so on? Well, so what? Would it matter? Would it change anything we do in our lives or in policy? And I think the answer is, it does, actually. It is genuinely quite consequential. Should I take that job? Is the extra commute worth it? And it's a really fascinating question about, as this data becomes more and more granular, I mean, you actually really want to know is not just in general terms, but actually, is that a good bet? And a fascinating question is about how, as that more data becomes available, it is itself a sort of game changer, right? It changes the incentives, informs the marginal worker about where they choose to work. It changes the behavior of firms, right, who have to then respond to that. So, and that's true in many domains. But the most fundamental one, of course, is that when you look back on it, of course, employment and some of these things, pretty obvious they're going to be important, but it does flag up other issues which don't come through, so other kind of measures. And the obvious one is essentially the relational. It's about how we behave and relate to other people. So acts of kindness and compassion and so on, hugely important for our well-being. It's not obvious how they factor into GDP. Now, they do factor in some loose roundabout way through productivity, but actually, they're important enough, you might say, if they're important, we should measure them and we should think about their consequences.
What is the overall trend? Are we moving towards convergence or divergence in relation to what's happening in relation to well-being? Countries became more diverse. Actually, you would have thought that there'd be homogenization of their values and their experiences of well-being, but actually you were seeing nations diverging. So they converge within the nation, but diverge between them. Is that still what the data tells you?
I mean, in many ways, on some things, countries sort of drifting in the same general direction, but sort of slightly spreading apart. If you can kind of picture that in your mind, it's like a big bang kind of movement. And it seems that countries, I mean, we are collectively, apart from that we bump into each other and it affects who we are and therefore drives often convergence within countries, but we are making different sort of choices. So on a very global level, even though, of course, countries are generally getting richer and increasing subjective well-being, but we are making different choices. I mean, the one that stands out often in the data is between Scandinavian countries, where you seem to be using the wealth, essentially, to see more of each other and interact more and get certain kind of satisfactions, where in Anglo-Saxon countries we tended to use our wealth to escape from other people, basically. That's a sort of cultural choice that some countries seem to be making. Now, if you read this data and you say, well, we'll make us, happy, increase our well-being, it looks a bit like the Scandinavians make a better call, frankly. And that's a choice we can make individually and as a society.
Isn't this quite challenging data in an American context? Because it turns out things that Americans care a lot about, like cars, guns, TVs, burgers. None of these things seem to be terribly important to kind of well-being. What kind of response do you get to America to some of this kind of well-being data? Because it does kind of challenge certain notions.
As incomes go up, people use their money in different ways. So people in the U.S. that use their money above $75,000 to buy social time and experiences see better daily affect. And so part of it is the difference between those long-term objectives that everybody wants and aligning short-term incentives that go along with those. So do I buy social time? Do I buy experiences? Reminding myself that when I buy this car, it's only going to last a little while, then the novelty is going to wear off. So I think that's part of the education process and part of the awareness. And I think any change that happens due to awareness. It happens due to social expectations, and it happens due to leadership putting positive defaults in place that encourage people to make the right decisions.
If on the basis of all the data about well-being, you had to advocate one shift in public policy, what would be that shift?
I think what I take from the findings we've got so far from our national debate is kind of the range of things that are important to people. So probably searching after one particular answer is probably not the right way to do it. The kind of things that are coming up are kind of job satisfaction, people's own health, job satisfaction rather than how much money they earn, but maybe that's more to do with kind of once you get to a certain level, and also kind of family and friends.
What we find is that the really valuable Brit or the really valuable American is the engaged worker. And so there's about 30 million workers in this country, and 25% of them are engaged. Now, at the other end of it, you have about 25% that Jim and his fellow scientists euphemistically refer to as actively disengaged. When we segment the population, you have a group of people that absolutely love their job. So there's only 25 million Americans that are really juiced. But then you have about the same amount that come to work to try to annihilate whatever they're doing. If you said you get one magic trick, Jim, to just put the UK right on track, I'd double the number of engaged workers and I'd cut the number of awful, miserable workers in half, because With the engaged workers, that's where you have innovation, entrepreneurship, and you get new businesses, new startups, new customers, and new jobs. And then if you have fewer disengaged, you have less obesity, and that's where all the money is.
If you have ways to measure and understand, to put a firmer placement of responsibility at the individual's feet as it relates to their modifiable behavior choices. And what we know, the other largest influencing factor is environment. So a lot of times that's out of the control of the individual and the responsibility of leadership. And to be able to put accountability with distinct measure to leaders. And as I think about where people spend their time and get influenced by their environment and the kind of data that we saw within the early first quarter results, the work environment is huge. So when I think of leaders, there's public policy and government leaders, but there's also the day-to-day leaders that we get influenced by heavily.
I'd do something pretty simple. I'd find a way to reward organizations who do two things at once. Grow the number of employees they have in their business in addition to improving well-being. So combined, grow with improved well-being. So I would reward them for improving people's lives while they improve performance. That improves the economy and improves the future economy.